Military-related traumatic brain injuries are often caused by gunshot wounds, exposure to blasts, and motor vehicle accidents. When the head receives a direct blow, the skull may be damaged or fractured, resulting in brain damage. The severity of the brain injury can range from a mild concussion to a more severe injury that can cause long-term or permanent damage. Mild traumatic brain injury, or closed head injury, occurs when the head is hit or shaken. An affected person can become dazed or confused or lose consciousness for a short time. This type of concussion is seldom life-threatening, and recovery usually takes a few weeks or months. Moderate to severe brain injury often involves complex war injuries that cause periods of unconsciousness and possibly long-term amnesia. With moderate to severe brain injury, your service member may think and behave differently than in the past. If you notice your wounded warrior has difficulty making decisions, completing tasks, or concentrating, experiences memory loss, sadness, depression, fatigue, dizziness, or headaches, or expresses inappropriate anger, he or she may be experiencing symptoms of a traumatic brain injury, or TBI. Traumatic brain injury is a life-altering condition for wounded warriors and their caregivers. Although some common predictors exist, recovery is different for each individual. Living with a wounded warrior with a traumatic brain injury can place a heavy burden on the caregiver. It is important that you learn to help your wounded warrior and yourself during this time. Identify inappropriate behaviors such as anger, outbursts, withdrawal, and apathy, which may occur in public settings. Teach children about the potential behaviors they may see in your wounded warrior. Take part in community activities. Don't become socially isolated for fear of how your service member may behave. Avoid activities that could lead to another brain injury. Also, be aware that alcohol, caffeine, or energy-enhancing substances and sleeping aids can slow the healing process. Be patient. Your wounded warrior may find it difficult to learn new things or understand abstract concepts. Also, he or she may have communication deficits, such as loss of vocabulary. Join a support group for caregivers who are experiencing similar situations. Locate these groups by contacting your local Army installation's Soldier and Family Assistance Center, or SFAC. The Soldier and Family Assistance Center provides tailored services to meet the needs of wounded, ill, and injured service members assigned to the Warrior Transition Unit and their families. To find a location near you, visit the Soldier and Family Assistance Center, located on the E-Extension website. Helping an individual who has had a traumatic brain injury can be hard on the caregiver. However, you can use strategies that will help you serve your wounded warrior. Get plenty of sleep and rest. Establish a regular daily routine. Eat balanced meals. Monitor your health by scheduling routine medical examinations. Enlist the support of family and friends. Include humor in your life, whether by renting comedies, attending live performances, or finding other ways to create feelings of lightheartedness. Seek counseling from a trained professional if you experience an emotional meltdown. Take advantage of respite care available in your community. Your caregiving journey can be physically and mentally challenging, especially if you're caring for a service member who is suffering from a traumatic brain injury. Learning as much as you can about this condition will help you better serve your loved one during this difficult time. And remember, never give up. Staying positive will keep your wounded warrior optimistic and help him or her stay motivated during the rehabilitation process.